Greetings, my people. Good morning, good afternoon, good evening, wherever you are. I hope you're having a very great time. And thank you very much for clicking in. Thank you for visiting my channel. May you consider subscribing or hitting the notification bell, share and like this video. Today I'm making this video on behalf of my friends, my fans, and many people who have been asking how to get to UK as a registered nurse or how to come to work into United Kingdom. If you are new here, my name is Mary and I'm a registered nurse working and living in United Kingdom, and I'm coming live to you from Leicester. So then, in order for you to work as a professional here in UK, you must have qualified either with a diploma or a bachelor degree in your area of interest or the area of your profession. And once you have attained the certificate, you also need at least a year or two of experience in your country of origin. Having said that, you also need to do a computer-based test, which is available and can be done from your home country. You just need to Google the nearest center that can offer you computer-based test, which is otherwise known as CBT. That computer test is available in globally, and you'll be able to find a test which is near you. You must pass that test, and once you have done that, then you'll also need to write to the nursing council or the body that is registering your qualification. You write to them. In the case of nurses, it is the NMC, which is known as the Nurses and Midwifery Council of UK. And otherwise, if it is lab technicians or physiotherapists, you need to register with the HPC. For the nurses, once you have written to the NMC, you state your interest. You tell them that you want to come in and work as a registered nurse. Then they will write to your nursing council of your home country, and they will not ask you for a transcript of your training. They will write directly to the nursing council of your home country, and once they have received that, they will assess your qualification, they will assess your transcript, and they will tell you the areas that you need to work on. Once they have communicated back to you, you need to apply to the recruiting companies or the recruiting agencies, or even the National Health Service, and they are the ones that will give you a sponsored visa, which is called Tier 1, which is a highly skilled migrant visa. Once you get that visa and you have come onto the UK, the first few months or the first few weeks of your arrival are very important. You have to try and link yourself with the people who have done the registration, your friends or other colleagues or people that you know that are living in UK, so that your startup life will be much easier. You'll be able to talk to people. You'll have people that you can always seek advice as far as living in United Kingdom is concerned. Now, once you arrive here in UK, you will be required to sit for exam or assessment called OSCE, which is otherwise known as you'll be given scenario where you'll be asked to assess a scenario of a case study of a patient, so that they can see how you can assess and implement your care for that patient. This will involve you doing a head-to-toe examination, a simulated head-to-toe examination. That is the what is called OSCE, which is a structured clinical examination. Once you have passed that, of which you must pass, you should also attain an English proficiency test, which is known as IELTS. And you must pass with a mark of 6.5 and above. Now there is a discussion going on within the NMC to find out if they are going to reduce this mark, because many people have been failing. It's not that they can't speak English, it's not that they can't write English, but for some reason they have been failing. And NMC obviously want to ascertain that you can communicate in English, you can listen, and you can, you are able to translate your medical knowledge in written English, and as well as communicate with the patients. But there has been discussion to see how they can reduce this, and especially if your training was attained in English, that is your whole bachelor of science was attained in English, or your diploma was attained in English, then they are considering to lower this mark. So those are the 4 things that you need to do. You need to pass the English test. You need to have such the computer-based test, which is known as CBT. Then after traveling to UK, having attained a sponsored visa, you need to sit for the OSCE. And with the OSCE, there are only, at the moment, there are only 3 centers that are offering this OSCE for overseas nurses, which is Northampton, there is also London, and also Ulster, which is in Northern Ireland. So you, as I've said, you must pass this exam. If you don't pass, then they will offer you an opportunity to resit the exam, that is the OSCE, but this time it will cost you money, and it's quite expensive. So they will ask you to receipt, and you pay for rate £400. It's about £397, but actually it equates to £400. So you must really work hard in order to pass it the first time, so that you don't have to repeat it again and resit. It is quite easy as long as you're focused and you follow the instruction, you follow the rules of the country, then you'll have no problem. Well, nursing in other countries, especially overseas, is very different from nursing in UK. And sometimes you might come here, and the first few months you look at when you're doing your practice in order to sit for the OSCE, you find that nursing is not your thing. If this ever happens, speak to your sponsor, let them know your difficulties, and they'll try and look for ways to support you so that you can, finish your course and sit for your OSCE. If that's not the case, please do not go underground. Do not disappear, because once you disappear, the law will start looking for you. And once you get into the books of the law, then there is a problem. You'll have blocked your chances for progressing, and you'll have blocked the chances for others who are aspiring to come. So the best thing, if you think you're not managing anything, speak to your sponsor, speak to somebody. It doesn't pay to be quiet, doesn't pay to run away or to go underground, because you'll have spoiled yourself so many chances that would otherwise have been avoided by just speaking to somebody who will be able to give you the right direction. So I wish you all the best, and those who are aspiring to come, there is nothing which is hindering you. You now have the information. Pass your English test. As long as you have a qualification, then if you are trying to come as a qualified nurse, you must have the qualification. If you want to come in as a healthcare assistant or a support worker, then you must have had a care certificate from your country of origin, and at least you have some experience of how to use the various equipments that are used by healthcare professionals when they are working as support workers or healthcare assistants. you have to have that certificate, and you will send it to the recruiting agencies. They will look at it, and if they're happy with it, they will continue with the recruitment process. So Google and find the recruiting agencies within the UK who are recruiting for overseas. There are quite a number, and I cannot speak for them because I don't work for them. But once you Google, you'll be able to find the right people, or just communicate with them and they will get back to you. Without further ado, that is all I have for you for today, and have a happy migration to UK.